It's a very important topic, and it's really top of mind for us at Rite Aid. We aspire and strive to be the neighborhood community pharmacy in the true sense of the words. And as we think about health equity, it's important that we can be in every neighborhood and serve every neighborhood equally and appropriately. So I think there's a couple of things that we're focused on. One is like my colleagues on the panel here, we've been partnered with the current administration and prior administration in ensuring the pandemic is being addressed and ensuring that not only testing but vaccinations are available to every American possible. So that's been mission number one for us. In the city of Philadelphia, where we have a preponderance number of stores, we're actually recognized there of standing up the most vaccination clinics in the city of anybody there. Beyond that, every day we think through how do we serve every single customer that comes through our doors. And that means everything from freeing up our pharmacists to address chronic care conditions, specifically as we think about health equity, obesity, hypertension, diabetes, and how do we think about that more pronounced in a subset of our stores. We've publicly shared that, like some of our colleagues on stage, we're looking at underserved communities. So our internal assessment says there's probably, majority of Americans are within 5 miles of a community pharmacy. There's still over 2,000 towns that are underserved, and we're just thinking through how do we address that going forth. And then lastly, we have our foundation, which is an independent business or nonprofit from Rite Aid, and we've really refocused that foundation. We've renamed it to Healthy Futures. We've picked 6 cities that we are very much focused on. The slide that was shared earlier about the entire wheel of how you address health inequities. And each one of those, that foundation is very much focused on solving for in those communities right now. But when you take a step back, today, there's a complete disconnect with what the role of a pharmacist can do relative to how the economic value stream works. It's all based upon dispensing. And, there's a lot of advocacy over the years. I sit on the CVS board of directors trying to get pharmacists the appropriate prescriptive authority in Part B, which would be critical in these underserved communities. And there's a lot of good work that's happening out there, but sometimes there's a lot of unintentional consequences that come with that. So you think about a couple of states across the country, Washington State, Idaho, which continue to be very progressive states on pharmacy practice. Where pharmacists can do a lot more acute testing, et cetera. And there should be benefits to that on preventing emergency room admissions, et cetera. So how do we lean on those to get those more across the board? I think about the current situation right now which I think was well intended, but not necessarily well thought through, about the Paxlovid situation right now, where technically pharmacists can prescribe within the first 5 days, which you have to, upon a positive test. But then you say, well, how do you get paid? You don't get paid. And then you're supposed to have a renal screening. Well, how do you get that, right? So, I think it's just more about how do you bring this all together. And that's a lot easier said than done. But I strongly, when I started my career as a pharmacist many years ago, and I strongly and passionately believe that pharmacists in general, regardless of whose name is on the front door, can play a much bigger role in the healthcare system and take costs out of the system, because they are the most accessible healthcare provider today. And as public policy, what needs to change? Regulatory policy, big part of this, right? And the last part, which I think we're at the tip of another round of this, is this whole issue of pharmacy shortages. And as that continues to play out in the next 24 months, what's the impact on communities and staffing stores and keeping stores open? We pride ourselves on what we call hustle with humility, And so as we learn something in one community, we're pretty quick to share. And I call it a very Homer Simpson manner, just share and so people in other parts of the business can pick it up and run with that. And that's something that we benefited from my opening comments that I shared about our work in Philadelphia in the pandemic. We took that work and really put it into our communities pretty quickly, and everything from faith leader partnerships through schools through to anywhere that would take us and allow us to help. Right, I think that's really the message out of this, is that our pharmacists in those stores in those areas are the best to know who to reach out to. It's not somebody sitting in some office somewhere. So it's really about giving them the resources in a very freedom within a framework perspective that they can then run